Deuterium is a buzzword in the alternative health community, and there are some people say that there's no such thing. It doesn't impact your health. But today I have on Dr. Petra. We are going to talk all about this topic and her clinical experience with people in treating cancer, in treating autoimmune conditions, obesity, metabolic conditions, how you can actually improve your mitochondrial health through looking at it through the lens of deuterium, and what the average everyday person should do as far as deuterium depletion goes. Some free, easy, practical stuff that anyone can implement. I think you're going to find this conversation truly interesting, and I'm really appreciative of Dr. Petra for being on. All of her information will be down in the show notes. Thank you so much for listening. A lot of people are quick to talk about the benefits of sunlight, but what gets often missed in the conversation is the benefit of darkness and the importance of protecting yourself from blue and green light after sunset. That is why I choose Viva Rays as my go-to source for protecting my circadian rhythms. You can use the code YOGI to save 15% off at Viva Rays. Now, you may have seen some of these studies popping up. I call them fear mongering about blue blockers not being effective. And that is a partial truth, because when you use blue blockers that are clear or that have not been tested with a spectrometer to actually block what they say they do, they will not protect your circadian rhythms. And they are not catching those key wavelengths that you need to be blocking in order for your body to be able to repair, for you to make melatonin, which is a master antioxidant. And artificial light at night has been in the scientific literature extensively linked to a host of hormonal cancers, obesity, diabetes, and all sorts of metabolic issues. That, again, is why I choose Viva Rays as my go-to source for protecting my circadian rhythms to allow my body to get adequate darkness at night. You can use the code YOGI to save 15% over at Viva Rays, and you can actually trust that they block the frequencies of light that they say they do. Thanks to Viva Rays for sponsoring today's podcast. Today's show is brought to you by Upgraded Formulas. They have my absolute favorite magnesium. You can get the best and only clinically studied stabilized nano magnesium supplement on the market from Upgraded Formulas using my code YOGI for 10% off. Did you know that magnesium is actually required for over 800 enzymatic reactions in the body? This clinically studied magnesium has proven to improve sleep quality and energy by over 60%, specifically improving light sleep measurement by 90%, REM sleep by 150%, and deep sleep by 250%. That means more energy, better mood, and deeper sleep. Who doesn't want that? What makes this the best on the market? This specific magnesium is nano magnesium, which means it is easier for your body to absorb and use. In fact, it is absorbed up to 99.99%, which means you'll feel the results instantaneously. Hello, everyone. Welcome back to the show. Today, I am so honored to have Dr. Petra here with us to talk about deuterium, about women's health, about what she does in practice. Because I feel like we've had some deuterium episodes, but we haven't really taken it down to like working with patients on a practical level. So thank you so much for being here today.
Oh, it's my pleasure. It's an honor. I look forward to our conversation.
Yeah. Well, tell my community here just a little bit about yourself and how you got into the work that you're doing and what it is kind of the work that you do.
Yeah, so I am a naturopathic doctor who has been specializing and learning about deuterium and deuteronomics since 2018. I have tried to integrate it really with every patient. A good share of my clients are wellness and women's health and thyroid dysfunction, hormonal imbalances, and then there's a large share of those with a cancer diagnosis as well. So it's a combination of clients that I see, and I use the science of deuteronomics, which, as you know, is fairly new, in all ways that I can apply it and continue to evolve in that.
Yeah, I think the cancer is just something that is continuing to proliferate. So many people are having cancer diagnoses these days. And I get a lot of women in my private membership group who are cancer survivors or get diagnosed with cancer. I've always kind of sent them towards Dr. Boros and Dr. Smalier's work around cancer.
Mhm.
But it sounds like you do this clinically. So a patient would come to you with a cancer diagnosis, and you would actually be able to um, implement some of these things that you know about deuterium into their care plan. Is that correct?
Yeah, that is exactly correct. I
Mm.
do that alongside any of the other treatments that have been chosen, proposed, prescribed, initiated. But it's a very important piece because I think that it's extremely supportive to add the aspect of regulating deuterium. You want to, in some cases, rapidly deplete.
Mm.
Then you also really want to maintain, and you do that by addressing the food, your light, all of the lifestyle pieces that we know are so important to um, reverse any of these cancerous processes. And so there's such great data, as you just mentioned, both from Dr. Boros and Dr. Shomia's data, that it really using deuterium depletion and specifically water, that's where the most data is. The effects are great in terms of extending overall survival time. And based on Dr. Chomier's over big study that he did in the last decade, it actually increases life expectancy from the average of 2.8 years, and this is based on the Hungarian population, to 11 to 15 years. So
Wow.
yeah, there is no other therapy that can even come close to making a shift like that.
And you mentioned that some people will do like a standard chemotherapy or radiation protocol alongside of deuterium depletion, and it's not an issue.
No, it supports one another. Yeah,
Okay.
it's
Yeah.
and you actually will have less of an effect of the therapies that are chosen. You want to be careful with antioxidants, of course, but being in a state of ketosis, we also know very much supports the treatments of radiotherapy or chemo for that matter. So it's a very beneficial way to approach it.
So
Yeah.
you mean antioxidant therapy like vitamin C, glutathione, those sorts of like IV therapies that some people get alongside of these chemotherapy?
So vitamin C is a pro-oxidative therapy.
Mhm.
Glutathione, though, is an antioxidant. So yes, that would not be indicated at the same time that you're doing these therapies altogether.
Why
Yeah.
would that be? Is it because it does something negative to the mitochondria?
You're opposing the actions of all the other agents, basically. And
Mm.
so that makes not really any logical sense.
What about
Uh,
something like NAD? Because that's a big popular doing NAD IVs right now as well. So I assume that would be in the same as the glutathione.
That would be the same. And truthfully, I think NAD IVs don't make a whole lot of sense because it's ultimately about making sure that you have the a low deuterium amount of protons and not deuterons that are, presenting themselves at complex one, that where
Mm.
NAD,
It's
picks them
made.
up. So
Yep.
that's that piece. I think you're much better off making sure that you consume foods that don't contain glyphosate so that you
Mhm.
don't inhibit the production of the NAD precursors in your own body, and then making sure that you supply your body with foods that are low in deuterium. That's your best strategy all around. You don't need no
Mhm.
NAD IVs for that. Why are you making
Yeah.
a face?
Because just see all of these like influencers now doing these NAD IV therapy. And I'm like, I just don't think that's a good thing. I don't think it's a good idea. I think it actually could end up harming people.
It could,
Um,
and people don't always feel well. They don't.
right.
They could get situations where they actually need to seek care because, yeah, it shifts certain things that you don't want to be shifting. So, yeah.
Right. Yeah. So you start with a patient. Let's just take breast cancer for instance, because I
Okay.
think that's a big one that's more and more common these days. A patient comes to you with breast cancer. How do you approach that? Because I've seen some with deuterium depletion that if you deplete them too fast, it can cause issues and a quicker death. I don't know if I'm misinterpreting some of that research, but what do you say on that?
Oh, I have never heard of that at all. Please show me
Hmm.
that research. Love to know about
Yeah.
that. So how I approach it is as follows. It really depends on at what point the client will present. If it's
Mm.
very early on, then we can help guide, the process of how to determine what treatment strategies to take, depending on what the pathology reports and the imaging reports tell me, and then guides through that process. And implement definitely deuterium depleting and deuterium regulating strategies. That's a really key component. And then based on, the stage of the diagnosis, the comfort of the woman to implement some of these strategies. And then we can go as far in all directions of all the current used therapies and combine them, so as much
Mm.
as we can do. Yeah.
Mm. And with the water, so I'm sure you do diet as well with people. Do you put everyone straight to keto, or are there varying degrees of what you do with diet?
Yeah, there are varying degrees because it's depends on where the client is and understanding of how food can make a difference for them.
Mm.
Initially, to make a shift, it can be really hard to get into ketosis, certainly if you've not ever done it. So
Mhm.
achieving this metabolic flexibility is really what I'm after, and we know that the benefits of therapeutic ketosis are great because you shift the way you produce energy. And so that's extremely important, but it isn't right for everyone. And so just taking that as a very individual approach. Yeah.
Mm. That makes sense. And that's good because I know some people they're scared to make these dietary shifts. So would you kind of
Yeah.
go more towards water with that person, or it's like I'm sure it's a holistic lifestyle program it's not just like here, go drink the water. I'm sure you kind of look at everything, right?
Yeah, exactly. And it's also not doable for everyone to do the water, right? That's another piece of it. But improving the quality of your water is a great place to start. Simply reducing the amount of water you consume
Mm.
is causing deuterium depletion, right? That's this other piece. A lot of us have been told, oh, you must consume half your body weight in ounces a day and keep drinking. And a lot of my clients actually present with drinking 3 to 4, sometimes 5 quarts of water, of liquids a day. And you are
Mm.
deuterium loading if you're doing that. And so just changing that piece and thinking about how what you consume throughout the day and food wise as well as liquid wise, how that can affect any physiology and biochemistry in your body. So that's a key piece. So what we're learning, if you pull deuterium away, you will pull away what Dr. Um, Boros has called, and others in the research, an oncoisotope. That is what deuterium is identified as. So lowering that is beneficial for everybody.
Mm. Got it. Yes. Would you say most people have a bit of a deuterium problem just in the modern world now?
Yeah, I think so. I honestly, I've tested a lot of people, and um, those with a cancer diagnosis, I don't really even have to check because I know it's going to be in the high 140s, 150s likely. I've had one client with 161, which was stunning
Mm.
because that's really above most natural abundance waters that we have access to in the US. So you really are not secreting any or able to get it out at that point. But yeah, everybody, as we age, as we live in this world of, ultra processed foods and a lack of light, and most people don't have great sleep. So all those pieces play a role. So yeah, I think it is an issue pretty much for everyone.
Yeah. Yeah, I mean, absolutely. And you mentioned levels in the high 140s, 150. What are the optimal levels that you like to see in a healthy person for deuterium?
Yeah, in the 130s, that would be amazing
Mm,
without water. So if you can do that with just food and lifestyle, that would be great. We think that if your levels in the body are below 130 parts per million, mitochondrial dysfunction really is not much of an issue. So maintaining that lower level, and you don't always have to do it. You can, again, cycle in and out of it. You may do that for periods of time. You can choose if you are a wellness client, for instance, and just want to once in a year, take a period of a month or two to just, yeah,
mhm.
let's deplete it. Let's take every aspect of my health and do that too. And I think that's really beneficial because prevention ultimately is what we want to do. I much rather you not have to come see me for a cancer diagnosis. So, it's a key piece if we can
Absolutely.
get it.
Yeah, I mean, it's one of those things. I mean, people, do you offer deuterium testing in your clinic? Or I know light water, because I just did a light water one back in April. I'm going to redo one to see if I've been able to get it down at all. But they
Yeah.
have a saliva test. But do you have a test that you like or that you use in your clinic?
I sent them to light water. Yeah, I do
Light
that.
water. Yeah.
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 Yeah. It's the easiest currently, and they're having a really fast turnaround. So it's great. And
They
you can
are.
test
That it
your
was
water as
very
well.
fast turnaround.
Yeah.
Hmm?
Yeah. Yeah. And you can test your drinking water as well. So you know what you're doing. I think that's really
Yeah.
useful as well.
Yeah. My water here is like 155
Right.
on the 30 on the 33rd latitude. So I know the more closer you go down to the equator, the higher the deuterium typically is. Because I have some clients that live up in Canada and their water is in the 130s.
Yeah.
Well water, spring
Yeah.
water. Like,
Yeah.
yeah, here it's pretty high.
Yeah. Well, that's what happens when you are near the coast and
Mhm.
indeed southern latitudes. You will get that. Yeah.
Yeah. Yeah, but we're supposed to be able to naturally, like what I was doing before we hopped on the call, is sunbathing in
That's right.
my little secret spot on the ground out in the UV index of a 10, sweating like crazy on the ground.
Good.
That depletes deuterium, correct?
Yep, it does. Yep.
Yeah.
Yeah, it's a really beneficial, and has all the other aspects of health. So many other properties of sunlight, as you know, are crucial. But yeah, it's a really effective way to do that. And
Yeah.
unfortunately, most of us have been told, just don't go in the sun. That's not good for you. But no, just please let go of that
Yeah.
uh, and do it.
Yeah.
Work on
There's
it.
a there's a safe way to do it, I think, too. Some people just don't understand. I'm not just going out there for 6 hours a day. I've been doing it ever since, the spring when it got warm enough to do. So I've been gradually building up my tolerance. And we're in
Yeah.
August now, I can tolerate a good amount of sun that would burn most people, but my body is really used to it. And so I go get all the benefits and I ground and sweat and, um,
Yeah.
I can get away with eating a little bit of some of the fruits that are in season here and not really worrying about
Yeah.
elevating my deuterium levels so much.
Yeah. I've found for those of us who tend to burn more quicker because of fair skin and so forth, it's really, like you just said, really important to start slow and then build. And you want to first, get the UVA light in the earlier part of the day and the later
Yes.
part of the day, and then your UVB. But I found another really useful agent, which is called chaga. And you
Oh,
need
yeah.
to get the Siberian one, the really dark one, because
Oh,
the chaga is actually a fibrous growth
melanin.
that grows only on birch trees. And so the outer rim of the fibrous growth contains this really deep dark color, and that is the melanin. And it's also
Oh,
very rich in betulinic acid, which is a powerful anti-cancer agent. So but what it does, the chaga, is it uh, I think supports your melanin in your skin,
mhm.
and having a more rich pigmented coloring will prevent you. It prevents you from
I'm
gamma
burning.
radiation, so it prevents sunburning. It's very protective, and I mean, I've tried it by going out in the sun midday for more than I would normally ever do, an hour and a half, right in Southern California, and I'm fine. I will not burn. So
Wow.
you
So this
can.
is a Siberian chaga. Is it a
Yeah.
capsule or are you drinking the tea
No,
capsule?
it's actually just a little sprinkles. It comes in little pouch bags. I've been buying it from Sayan International, Sayan. It's you can just get it in 2 ounce bags and 4 ounce bags. Try it. I add it to coffee. I like the flavor of it, and it's a resin-like texture, so you want to kind of melt it almost. Some people make chaga
Hmm.
cappuccinos or whatever you like, but I think it's been really helpful.
I'm going to be ordering some as soon as we get off the call because I was actually when I was doing my pregnancy prep and I started really getting into sun and tanning and just being outside and laying out. I forgot I was taking chaga. I had started taking chaga as part of my preconception plan.
Uh-huh.
Um, I think I had come into this information back then and I just like got pregnant and kind of forgot about it. So I'm going to go ahead and get some of the brand that you recommend. And it's Siberian Chaga and the brand, because I know people in the comments will ask, it's Sayan
Yeah,
International,
I
correct?
think it's what it is. Yeah, saying if you put that in the any Google box, you'll find it. Yeah.
Okay. So everyone listening, I know they want to know.
Yeah.
They could go get
And
some.
you don't need a lot. You can just sprinkle a little on the bottom of the cup.
A little
It's
sprinkles.
powerful. Yeah.
Okay. Small sprinkles.
Yeah.
Don't overdo it.
Oh,
Like we
it's
love to
bitter.
do here.
Yeah, it's hard to take then.
More is better. So
Yeah.
that's a great thing people can do
Yeah.
to help deplete deuterium. Period is just going out in sun. And what do you see the importance of circadian rhythms in deuterium depletion? Because I think this is a really overlooked part of health in general. But when it comes to depleting deuterium, if you don't have your light dark cycles set up properly, this could really be an issue, right?
Absolutely. Yeah, it's really crucial to go in the sunlight, get all those cues that will trigger all the right, hormonals in the right pathways. So that will also improve your sleep. And
Mm.
sleep is crucial for depletion. That's when we deplete a large share of it. And, once you get your regulation of deuterium in control, you'll notice you need less sleep as well.
Mm.
You'll wake up when the sun rises and you go and have your day. But sleeping in a really dark room is important. Another piece that's happens when we sleep, we start to breathe at a lower rate and less deep, which is again very beneficial. It actually enhances the exchange of the oxygen and CO2, and it's another piece that we want to think about how to integrate. I don't know if you've ever heard of James Nestor's book, Breath.
Oh yeah. Mhm.
Yeah. And so there's a lot of great information in there, but this goes to a whole other part of it. But it's really another piece of depletion and regulation is breathing correctly. And we don't want to overbreathe. Most of us are overbreathers. That is
Mhm.
an issue. And we deepen too deep. So based on James's book, you can see that, breathing 5.5 times a minute. And there's a little, a great handy app that's free that you can install and time yourself and try to go down to that level, 5.5 seconds in and 5.5 seconds out. That gets you about 5.5 breaths a minute. So very
Mm.
helpful. Yeah.
Yeah, I think that's extremely helpful. And how do you feel about mouth taping?
Yeah, if that's required, do it.
Yeah.
You
Yeah.
may want to do the center so that you have, if you need to breathe, you will. But
Yeah.
yeah, that's a useful tool. Absolutely. Yeah.
Yeah. We both do it. My husband does it now.
So,
So
yeah.
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 Two
And
part
even
every
exercising, I'm sorry,
with the mouth tape.
walking, I did it again. Walking with your mouth closed and exercising with your mouth closed, that's another piece of being able to more efficiently utilize the oxygen that you do take in. My sister has been doing this. She's a runner. She loves to run long distance. And she said the first time she tried it, she could only do it for 100 meters. Now she
Mm.
can do it 6, 7 kilometers, and she's stunned by
Wow.
it. Yeah. Yeah. So it's quite interesting.
Yeah, my friend and podcast partner Carrie Bennett, she and her husband love to run sprints together,
Mhm.
and she will do mouth tape when they're doing the sprints. And she says when she tapes her mouth when they're sprinting, that
Mhm.
her recovery time, like she's ready to go for another one, and he's still kind of like, but she's
Yeah.
when her mouth is taped,
Yeah.
when they practice it, it's like she can go right into another sprint, because her, I guess she's better utilizing the
Right.
energy.
Yeah.
Yeah.
Yeah. No, it's
Yeah.
really interesting. My sister was stunned by it, the improvement she got out of it too. Yeah.
Mhm. I'm gonna have to try that. It's people kind of look at you like,
Well, you can close your mouth. You can do it. You don't necessarily have to tape it.
yeah, do it,
Mhm.
tape it. Yeah.
Yeah.
Yeah. Yeah. That's true. Very true.
Yeah. It's hard though, I have to tell you, because I started doing it on my walks up the hill, up the canyons here, and it's like, okay. Yeah.
Yeah. It's like almost 100 degrees here today. So I'm like, maybe maybe wait till it gets a
The
little
fall.
cooler.
Yes. Yes. Yeah. That's
Yeah.
fine.
Yeah. But definitely some things to try. So we've
Yeah.
got breathing,
Sleep,
food,
light.
sleeping. Yep.
Yeah. Um, These are really the biggest pieces. Food is crucial, as you know, in shifting levels of deuterium. It really does work. I know that light is another huge, huge aspect of all of this. Absolutely, I'm not denying that in any way. But generally, those that come to me have been consuming a higher carbohydrate diet, and we have to shift away from that. It's really key. So.
Yeah. Now I know why the high carb diets are so deleterious when we talk about deuterium, but maybe you can talk to some of my community about why that is.
Yeah. So any food has a very specific concentration in parts per million again of deuterium. And it happens to be that fats are the absolute lowest, right? And then you have your animal proteins, those of animals that were allowed to grow in their natural habitats, ate their ancestral diets, not in confined operations and so forth. Those are lower. Then you have your kind of green vegetables that are above ground. Then this is let me give you a little bit of an idea. So the fats can be anywhere between 102 to 110 parts per million.
Mm,
The great quality ones, it gets up a little higher into the um, teens in grass-fed butters, olive oils, and then if you look at animal protein, for instance, an egg, the egg yolk is very low, will be 120 parts per million, but the white will be 145. So that's that
oh,
dense.
I never knew that. Okay.
Yeah. So, instead of having an egg white omelet, which lots of people do, please go.
Oh no, I've always just done the yolks. Like
Yeah,
the
just
whites don't even taste good.
no, they don't. Not really. But so yeah, have three yolks and maybe one or two whites, so just kind of shake it up.
Mm,
And then the green vegetables, and that varies depending on their water content. Cucumber will be much higher, but then
mm,
some broccoli, and depending how you prepare them, will be lower. The 130s, 140s. Then you get to your grains. That's
mm,
always around 150 or higher. Then the ultra processed foods, the genetically modified foods, they are much higher.
mhm.
Coconut water is very high again, so that there's a difference. Just like in the egg, the coconut puts the low deuterium in the fats, and the high
Fats.
deuterium is in the water. So
Mm.
anybody promoting these as electrolyte
Hydration.
types of, yeah, it's not really for consumption. Um, so there's that. And yeah, really to try and combine, fruits are higher too. I want to point that out.
Mhm.
They are in the 150 area. And again, you know, like you just said, in the summer months, and depending on where you live, of course, you can totally consume if they are in local to you and currently seasonal. Yes.
Mhm.
Um,
And you
but
go outside and get sleep
correct.
and
Yes.
sweat.
Yes, all of that. Yeah, that would be very helpful. Yeah. So,
Yeah.
yeah, so that's, does that make sense? That kind of
Oh, yeah.
difference between them? Yeah.
So the higher the sugar, right, in the
Yeah.
fruit, like let's say mangoes, papayas, we don't get those here. They don't grow in Georgia, but they do more so towards the equator. Um, there's a reason for that because there's higher UV index in those areas, correct? So there's
That's
like
right.
always a circadian
That's right.
um, match to your food, and the UV index correlates with what you should be eating. So it's
Yeah.
like
Yeah.
takes the drama out of all these different people fighting about foods. It's like, well, where do you, if you're in Canada, you really should probably never drink coconut water or eat papayas or mangoes. In my
Agreed.
opinion, I don't know how
Yeah.
you feel about that.
Yeah. I mean, I agree. You know, listen, everybody has to have a birthday treat, right? So make it that. But
Yeah,
I'm not the food police by any means, but I do think as a general, we need to stay away from those foods.
yeah,
They're not appropriate for a lot of us.
yeah.
So
And the seed oils, which are in all the processed foods, those can be like 160, 180 parts per million. Am I correct on
yeah,
that?
yeah, you
Yeah,
are. I mean, and that varies, right? Where they were produced, what country, what processing, all of that. But yes, they
yeah,
are definitely high. Yeah.
yeah, yeah. So it's not necessarily a good idea to have the whole motto of all foods fit and we can just eat the processed foods. It's not an issue.
Yeah.
Um, Going
No.
back to what you said, like a birthday treat. So let's say someone is very healthy and they're optimized and they eat the majority of their diet as local, seasonal. They're pretty healthy, right?
Mm-hmm.
What about if they do decide to have something with seed oils or have something occasionally that is high deuterium?
Hmm.
Um, how does that impact their body? Are they able to deplete it if they're a healthy person? Should they
Yeah.
stress out about it? Like,
No,
yeah.
don't stress out about it. Have it once in a while, really, because you know these are some of the joys of life, right? That we have, whether that's sharing that with family or just your own personal craving or taste buds that just occasionally would want that, you know. But just be aware of what you're doing and balance it out. I think ultimately that's the key. If your body is functioning at a high level because you're doing, you know, 90% of the time the right things, yes, there should be no issue with that, you know.
Awesome. Yeah. I like
Yeah.
to put that out there because I think some people listen to podcasts like this and they're like, okay, no deuterium, no birthday, no this, no
Mhm.
that. And I don't live that way, at all by any means. I do indulge every now and then. Um, and I don't want people to think I have to live this like perfect life. But if you're a very unhealthy person, if you're dealing with something like cancer or obesity or diabetes, then
Different story. Let's get you normalized first, and then we can talk about that, you know. Yeah.
yeah. What's
Yeah.
the correlation with things like I know I've seen some of the work around diabetes and deuterium, but maybe you could talk a little bit about the link between obesity and deuterium, um,
Yeah.
so people could understand it a little bit better.
Yeah, so really, what happens is if your body collects too much deuterium,
Mhm.
ultimately you will slow down the mitochondria functioning, and that causes the backup of all of the different inputs that we normally get into our mitochondria for complete biological oxidation, is what we call that, meaning all the foods that you eat, they have to be entirely broken down. And
Mhm.
that happens in these, you know, involved biochemical pathways that a lot of us, you know, had to learn in medical school and most of us have forgotten. But the key is that every step of the way, it's really seems to be about removing deuterium from what you've just taken in, the foods. We would call that the substrate that then comes and enters ultimately the mitochondria for complete biological oxidation. So if that does not happen efficiently,
Mhm.
some of these start to back up. And depending on your propensity, your genetic, history, your ancestors, you might start collecting that in fatty, in cells. So that's adipocytes. So the fat backs up and you're going to start storing it. And the same happens in neurodegeneration. It may just play a role in your brain. And for others, you're going to form cancer cells, and so it really depends, but at the heart of all of it is ultimately the deuterium over stressing the system, it not working, it backing up, and we call that process metabolic crowding. And then that crowding, all sorts of the little parts of the food that you try to break down, they can't go down the pathways they're supposed to go, and then that causes branching out of the TCA cycle, and different things go wrong. And yeah, there you go, off comes the dysfunction. And
Yeah.
yeah, does that make sense?
Mhm. To me, yeah.
Yeah.
Um,
Okay.
I think talking with Dr. Pugh, she stayed with me earlier this year. We were talking about deuterium, and she is basically saying there's two checkpoints that deuterium goes through before it hits the mitochondria, right? TCA
Mhm.
cycle and the Krebs cycle. Is that right?
Well, the TCA cycle is the Krebs
Is the
cycle.
Krebs cycle?
Yeah, it's the same thing, but glycolysis is a really
Yes.
important pathway. That's
Yes.
the one that breaks down all of our carbohydrates, all of our sugars. So that's a key piece. And then in the TCA cycle, again, there is constantly these water exchange reactions taking place, trying to make sure that deuterium, is not part of that. So that happens there. An important part to realize is there is no such kind of a gateway, if you will, for fats.
Mm,
So if
yeah.
fats are high in
Make it
deuterium, they will go in. That's it.
right
And
into the mitochondria.
yeah,
Oh, wow. Okay. Because
yeah,
they enter at cytochrome 2 in the mitochondria. Yeah.
yeah. But the
Oh,
protons,
wow. That's why the seed oils are so bad.
right? There's
Huh.
no gateway. Nothing can take that off, right?
Right.
So
Because glycolysis is how, oh, now it's all coming to me.
yeah,
Okay,
good.
I get
Yeah,
it.
yeah.
Um, yeah. So that's why those fats, you have to really be careful about the types of fats that you're eating.
Yeah, it's a crucial piece, and of course, eating out is is
Mhm.
is a risk because you have no control over what you're eating, and you can bet on it that they use the cheapest oils that they can have their
Oh,
hands
totally.
on, and so that's the
100%.
problem. That's where you get it, eating
Mhm.
out. So
Absolutely.
unless you really go out of your way to do the farm to table thing, but
Right.
um
There are
most
some, I know there's an app now called Seed Oil Scout that
oh
people can
really?
use to
Yeah.
find restaurants that don't use seed oils. It's a fairly new app, which
Oh, that's
there
a good
been
yeah.
some, yeah, some people got mad about it. It's people get mad about everything, but I love these types of conversations because we're not like fear mongering. If people want to go eat the foods they want to eat, go ahead. But like we just want to kind of give people the informed consent. Like a fat is going to be a lot more of an issue deuterium wise to your mitochondria. So a seed oil
Yeah.
is going to be a lot more of an issue than like a mango. Um,
Yeah.
in many cases because there's no checkpoint for it to go through, and it has much higher likelihood of accumulating in the mitochondria, which is going to slow down that flow of energy in the mitochondria and could break the ATPase, leading to disease, metabolic dysfunction, and just really destroying the way that your body not only is able to take in energy, but put out energy. Am I correct in saying that?
Yeah, absolutely. And in that same vein, any kind of animal proteins that you would consume, that's also key to have the natural forms because again, the others will be higher in deuterium for the same reasons, especially their
Mm-hmm.
fats. So their fatty composition is a really key piece of their nutritional power for you. So that and it
Yeah.
doesn't necessarily need to be completely 100% grass fed because I know that leaves you with very little fat and you want fat, so that's
Mm-hmm.
but it's all about what the animals were fed. Were they able to get glyphosate free hay and
Yes.
grass and all of that, that's, I think, more important ultimately. So,
Yeah.
yeah.
How do glyphosate and deuterium? I know Dr. Senef is kind of writing a book right now about this topic, but how do glyphosate and deuterium come into the picture together?
So glyphosate really disables the enzymes that we require to efficiently keep deuterium out of all of the cellular processes. So that's a key piece of it. It's also chelating all the metals, including copper, and copper is the cofactor to produce your own metabolic water in complex 4, right? And we can't do that efficiently when we don't have copper. So copper is, by the way, essential for so many other pieces of our, biology and physiology. So that's a huge part of it. It controls iron metabolism, so we have to have enough of that. But so glyphosate really, it's just it really is a disabling agent on many, many different levels. So it's impossible, I think, in the world we live in currently to avoid it entirely because it seems to be just omnipresent. But we can certainly make sure that we're not being exposed heavily in foods that we consume and or spraying around our houses. And that's another huge piece because people just aren't aware of it. But yeah.
So when it comes to our health, though, just getting back
Yeah.
to kind of some of the basics,
Yeah.
we want to avoid glyphosate
Yes.
and and try to avoid exposing our bodies to more deuterium than we naturally would. Um,
Yeah.
what else would someone need to look at?
Yeah, so what you were just talking about in hydration class that you're working
Mhm.
on, I'm going to point you to a
Yep.
paper that was published in 2016 where a European Beverage Association was trying to see what type of liquid would be the most hydrating of all for us.
Mm.
And what was fascinating is that they took 24 healthy men, I think 24 or 72, either one, and they divided up 8 different beverages: orange
Mm.
juice, water, low-fat milk or non-fat milk, and whole milk, some hydrating solution, which had just salty,
Health.
aspects of it, and some others, Coke or, sodas. And they found had asked these participants not to consume anything after 8 a.m. And then at noon they had to present, and then in a half hour they had to drink 1 liter of liquid. And
Mm.
they were going to then be observed for 4 hours after that. And they stopped observing at 2 hours because everyone had already, within the first 2 hours, excreted or peed out way more than they had taken in. The ones that were the lowest were the hydration one with the solution with some salt in it, and the high
Mm.
fat milk. All the others,
Mm.
and that's because, of course, that is a little lower in deuterium because it has some fat
Yep.
in it, right?
Yep.
And all the others, some actually had peed out 1.4 liters, 1.6 liters,
Wow.
way more in excess. So drinking these huge amounts is really not
No, I don't
doing what you're
recommend
thinking
that.
it does. Yeah.
No.
So
Yep,
um
I definitely don't recommend that. And yeah, I think I remember that in my nutrition boards is that with the high fat milk, wasn't that shown to be the most hydrating? Yeah, I think that is because of the fat and the
yeah,
deuterium.
that's right.
Because everyone's like, oh, it's the mineral content. Is like, well,
Mm,
maybe, but it's
no, I don't
yeah.
think so. So yeah, I mean, again, we produce our own metabolic water, and that is
Right.
what you have to activate and honor. And yeah, you'll be fine. You don't need all that water. You just like
No. Yeah, that's the thing. I see people with these big like gallon jugs of water going around drinking, and I'm like, um, no, that's not a good idea.
yeah, yeah, you're right. That's totally right.
Yeah.
Yeah.
Yeah. And then the second runner up was the one that had like a saline solution in it, correct?
Yes,
So
it
there
was some
was
artificial rehydrating
electrolyte.
solution. Exactly. Yeah.
Yeah.
Salt.
Yeah. Yeah.
Yeah.
Yeah. So I do think people, if they're going to I don't know how you feel about this, but I do think that should be some mineral content in the water. You shouldn't just drink plain distilled or plain reverse osmosis water. That number one, distilled water is like 155 ppm or 153, something like that. So that's one of the highest ones you could drink, period, unless you're getting something like I've got these light water that are 5 ppm. That's distilled water, but it's deuterium depleted. So
Yeah,
yeah, that's
agreed.
kind of the worst type of water that you could drink, in my opinion. I don't know how you feel about that.
Agreed. Yes, yes.
Yeah,
We need electrolytes. We need salt. Sea salt, I'm a big fan of. Yeah,
yeah, yeah,
absolutely. Yeah, yeah.
yeah. So
Great.
we talked about cancer,
Yeah,
obesity.
yeah.
What else do you think people need to understand around this topic and their health? And maybe let's just talk about someone who wants to do health prevention. Like I want to just optimize my mitochondria, maybe do a short-term depletion. Should someone do something like that maybe once a year, once a couple times a
Every six
year? Like,
months. Yeah, yeah. I mean, I am totally in favor of that. I think it's really useful to do. I mean, honestly, it restores cellular function, organs, tissues. It can reverse thyroid issues that you may have by just improving your overall energy production in all of your cells, and that will benefit you. It will benefit anybody. And also, if you're looking to actually enhance your current performance, whether that's cognitively or on the ball field or on the playing field, wherever you're trying to do any athletics, all of it will you will improve. So I think that's what we all want ultimately, right? Yeah.
oh yeah. So you would
Yeah.
probably have somebody do a whole lifestyle program,
Hmm.
possibly a ketogenic diet, and then with water, would you
Yeah.
tell them to like dilute to a certain point, like 120 ppm, 130? What's the typical dilution point that you try to get people to drink all their water at if they're doing a depletion?
So if you're doing a depletion, it has to be therapeutic level. So about 125 parts per million to me is like a wellness level. That's nice if you can do that, but to actually actively lower your level, you should be around 100, 105 ppm. Um, and just for a period of time, but you will really drop down. And depends on your sensitivity. It depends on your some feel that they feel the shift.
Mm,
So just be aware of that. You can feel slight things as an increased heart rate or a slightly
mm,
being out of it, or some people feel detox effects. Not a lot, but some people do feel it. So I want to acknowledge
mhm,
that. But I think if you really do that for a shorter period, and again, depending on your body weight, right? So if you are larger in size, you may want to be a lower rather than higher, certainly if you don't drink that much. So it all evens out body weight, intake, what you're trying to solve,
yeah,
those make a difference. Yeah.
absolutely.
Yeah.
Yeah. And what else was I going to ask you about that? So maybe just like once or twice a year. What about a woman? Because that's how I got into deuterium depletion. Oh, and then anybody who does want to do it, do you think people can just do it on their own? Or would you rather them do it under the care of a physician, or is it like kind of situation dependent?
I mean, it's entirely situation dependent. Certainly, you can do this on your own if you are aware of how your body, functions and changes. Yeah, I mean, I think there's enough data out there, and I have lots of information on my website too that you can figure this out. I think when there is a real medical issue that you're trying to reverse, it's super helpful to work with someone that understands how to do it and then can kind of guide you through it and cycle you through certain parts of it, and just make sure that you address all the aspects that you can address wherever you live in the world, and according to budget and all of that. It's just good to think about, but yeah,
Yeah.
it is, it's I'm not a big fan of drinking it up straight, so
Oh
that's I
no.
no. But people do sometimes, and
Yeah.
you will feel it, you really will, and
Why
it's
do you not like people drinking it straight? Just I want to hear from you.
Because you drop too low, and I
Mm,
don't think that's the key. The key
mm,
is finding this happy balance.
mm.
You need deuterium, right, for very
Yeah,
specific processes. We need it for all of our structural proteins, our bones, our
collagen.
yeah, collagen, all of that, connective tissue. So, I think initially you may really get great benefit, but if it will stop, you will actually maybe not perform as well in your athletics if you just go too deep, if you drink it up straight. And some people don't feel well, literally. You feel, I mean, I feel it. If I drink a bottle of 5 ppm or a glass of that straight
Oh
up,
yeah,
yeah.
yeah,
So others don't feel it though,
yeah,
but there's a great variety in all of us. So,
yep.
but there is that has been published in the data. You don't want to really consume this under 50 parts per million. Uh,
Mm-mm.
there is something registered as isotopic shock. So there is that big shift that you invoke. I mean, just think about it. You've been consuming water of 150, give or take, your whole life,
Yep.
and all of a sudden you drop that down. That is going to cause a shift. We have a lot of deuterium in our body,
Hmm.
5 times as much as glucose, 12 times as much as magnesium. It's significant. So if you shift that, you will notice. Yeah,
Mm,
both good and bad,
interesting.
you know. Yeah.
Definitely. Yeah. Because
Yeah.
I feel like it's another one of those things that people think like more is better. I'll just buy the 5 ppm and drink that straight, and that's all I'll drink for weeks and
Yeah.
weeks. And then it's like
Yeah.
maybe not a good idea for your
No,
body to do.
no. People can fall, everything within reason, right? And moderation in
Right.
that sense. Yeah.
Right.
Yeah.
And a woman, so I got into deuterium and deuterium depletion before I got pregnant with my son. It was one of the things that I was kind of led down that path to look at deuterium as a possible issue as to why I wasn't able to get pregnant. And then I talked with Victor Sagalowski, and he told me about the women, who are drinking the water and getting pregnant in their 60s. And I was like, all right, I'm in. Um,
So
for, yeah, go
yeah,
ahead.
no, that just makes sense to me because what you're doing, and if we take in consideration this the endothelial surface layer glycocalyx complex, so it thins
Mhm.
out when you are lower in deuterium. So that provides access, even that's about around your oocytes, right? So there's
Mhm.
better access for penetration of a sperm to get in there, and
Yep.
you know the magic
Yep.
happens. So yeah, it makes perfect sense. You change the surrounding the environments, and yeah, it works.
Yeah. Yeah. And it helps to basically improve mitochondrial function as well, correct?
Yep.
To do
Yep.
depletion,
Absolutely.
which
Sure. Yeah.
everyone says your egg quality is based on how well your mitochondria operate in the first place.
Yeah.
Um,
Yeah.
so men could do it too if they wanted to improve sperm quality, I guess. Yes or
Yeah.
no?
Yeah. Of
Yeah.
course. Yeah. Motility,
Okay.
mobility, all of it. Yeah.
But then once you get pregnant, you don't want to continue to drink that water, correct?
I mean, you could add that level of the wellness. Um,
The 125,
yeah,
130.
exactly. Yeah. Yeah. That would be fine. Yeah.
Okay. I stopped. Like I started my depletion, I think in September. And then I felt so good. I didn't want to stop. I was like, oh my gosh, I felt so much energy, weight loss. It was just like amazing. I
Yeah.
didn't want to stop, but I had a friend of mine who was like, you got to stop before you get pregnant. And I was like, okay. So I stopped in December with the depletion and then got pregnant in January. And I have had all these waters. I have got like 4 cases of the 5 ppm. So I've been doing a little playing around with a little depletion lately now that I'm not breastfeeding or anything.
Yeah.
Um, but yeah, I stayed away from it through the whole pregnancy just because people are
Yeah.
like, you need deuterium for pregnancy. You have to have it. I'm like, okay. but,
Yeah.
but you're saying you could stay more at like a wellness level if you really
Yeah.
wanted to. Yeah.
Yeah. You can. Yeah.
Okay.
Yeah.
Okay.
Yeah.
That's helpful to know for all of my ladies out there.
Yeah. Absolutely.
Um,
Yeah. Yeah.
what else do you maybe want to talk about that I didn't ask you about, or is there anything?
I mean, I think we covered a lot. I think this is a strategy or a set of strategies you want to implement kind of for life, and uh, yeah, keep learning, enjoy it. It feels great to be able to function at a higher level. I think that other part of the benefit is just your brain works at a much more efficient level. So I think that's another part that people should not lose sight of. It's important, and aging gracefully, as I'm trying to do, is
We
really
all are.
is just, yeah, what more can I want than my brain working at the best possible, level that I can make it happen. So
Yeah, because that's where we have, besides the oocytes, we've got the brain is really the densest in the heart of mitochondria, right?
that's right. That's
Yeah.
right. Yeah.
Yeah.
So
Wonderful.
yeah.
Well, if there's anybody out there who's listening or watching and they want to work with you, want to learn
Mhm.
more about you, where could they find you and more of your information?
It's just my website. That's where all of my information is. It's drpetrad.com. DR and then my first name and then the letter D again and .com.
Got it.
Yeah.
All right. Well, I'll make sure we put all that in the show notes for everybody who's watching or listening. And
Thank
yeah,
you.
thank you. And now I've been sending people to you that come to my community with a cancer diagnosis, with a history of cancer and wanting to optimize. And it's really lovely to have a
Thank you.
practitioner to say, okay, you're going to be in good hands and she knows what she's talking about, knows what she's doing. So if there's anybody out there listening who's looking for this type of help, then I hope that this podcast has given them some resource, some information.
Yes,
And
thank you for the
yeah,
opportunity to share this. It's so crucial. Yeah.
absolutely.
Yeah.
Thank you so much for listening to the Evolving Wellness Podcast. Just a quick little reminder, this is not medical advice nor meant to be taken as a substitute for working one-on-one with a healthcare practitioner. And if you enjoy the show, please head on over to Apple or Spotify to leave the show up to a 5-star review. If you're over on YouTube, please leave us a like, leave us a comment. I really appreciate you for being here, for listening to the show, and your support means the world to me as I continue to try to pull guests from around the world to bring you informative content to empower you to make decisions about your own health. Thank you so much for being here, and I look forward to seeing you again next week.